If you want to understand why healthcare is so expensive, you need to understand the 25% problem. Hi, everyone. I'm Ann Sunderland. I'm a communications officer here at the California Healthcare Foundation. And today I am talking to my colleague, Christoph Stremikis, who leads our market analysis and insight team. And we're going to talk about a topic that, affects every single Californian, and that is the cost of healthcare. So, Christoph, unfortunately, rising and unaffordable healthcare costs are nothing new. And I think people really just want to understand, why is their healthcare so expensive?
Yeah, and you are asking a question that I hear from my family and friends all the time. We know here in California, 1 out of 2 Californians has skipped healthcare in the last year due to costs, and about 1 out of 3 carry some form of medical debt. Think about a family paying $800 a month for coverage and then facing a $5,000 deductible. You're put in a position of filling a prescription or fixing your car. You have to choose between going to see the doctor or paying your rent.
Yeah. And, I ask myself this all the time. I mean, how did we get here with so many families, shouldering these astronomical healthcare costs? And, you and I have been on a project here where we've been talking to a lot of Californians directly about their experiences with healthcare affordability. And I know a lot of people feel like it is the profit motive in our system, it's corporate greed. And they're very upset that politicians, haven't done more about it. I mean, they are really angry.
People are right to be angry, and there's some truth in what you're saying there and what people are observing. That certainly is part of the problem. I would say the underlying costs of healthcare have grown unchecked for decades. You could think of these like something like the base ingredients of the system. I'm talking about things like hospital operating costs, equipment in a doctor's office, prescription drug prices. Those underlying costs of care have gone up year after year after year. And when those things go up, premiums, deductibles, out-of-pocket expenses, medical debt quickly follows.
Yeah, I mean, we just saw that in our latest report, which showed that the average premium for a California family is now over $28,000. And it has grown almost twice as fast as both inflation and almost twice as fast as, wage growth.
That is way too much, right? Like if healthcare premiums and expenses are growing way faster than wages, it means we're going in the wrong direction. Healthcare is getting more unaffordable. Now, here's a really complicated but important point. Some of that spending and that increase is going towards things we really want in our healthcare system. We want breakthrough treatments. We want to make sure we're getting good quality. We want hospitals that are retrofitted to withstand earthquakes. Those are some of those base
Yeah,
ingredients.
and that all at the end of the day, that all takes money, right?
That all takes money. We need that. We want to keep that. But here's another really, really important point. We call it here the 25% problem. 25 cents out of every dollar in our healthcare system isn't making patients any healthier. Another way to think about this is if you're going out to eat, you get a $40 bill at the end of the night. It's kind of like $10 just went somewhere. It didn't go to the quality of the
Right.
food that you were getting or the skill of the chef. It was just essentially evaporated.
If a quarter of all of our healthcare spending is not going towards getting people better care or making people healthier, where exactly is that money going?
3 big buckets, okay? The first bucket is something we refer to as administrative complexity or waste. There's lots of this in our system. Think about all the back and forth that happens between a provider and a health insurance plan. When your provider orders a service or a treatment for you, sometimes that goes to the health insurance company beforehand, and they have to make a decision about whether that care is clinically indicated, whether it's covered by your health insurance plan, whether it's safe in your particular circumstance. That's really, really important. That's an important function. But the process by which that happens is incredibly inefficient. There can be many, many phone calls back and forth. There can be faxes back and forth. That all takes time in money and is part of that wasteful spending that we've been talking about.
Yeah, I mean, I think we can all relate to that. I mean, I've gotten bills with errors. I've been on the phone. The insurance company has had to call the doctor. And I mean, yeah, it I think it's crazy making. And I think almost every Californian has had an experience with that, unfortunately.
All right, second bucket. You ready for it?
Yeah, go for it.
We really have a competition problem in this state. In many, many parts of California, there really are only one or two large health systems left that are providing care. Or in some parts of this state, you only have one or two options when it comes to health insurance. It's really simple economics at that point. If you don't have choices, the price for what you're buying goes up.
Yeah, I mean, they're kind of held hostage. That's the price they have to pay.
It's infuriating and it's unfortunate. Those prices are not related to the quality of the services, the complexity of the procedures, or the outcomes that people are getting. Those prices are determined by leverage in the market.
Got it. Okay, so we've gone through 2 buckets. What's the 3rd bucket?
Yeah. The last one is primary care and prevention. And here we're actually not spending enough money, Anne. We know that many people struggle to get in to see a primary care doctor to get very basic needs met. And it's sort of that old adage, ounce of prevention is worth a pound of cure. Here, if we actually directed more resources into primary care, it would save all of us money in the long run and people would be healthier.
Yeah. I mean, again, I know people who have put off going to the doctor because they're worried about their deductible or they're worried about, landing with an unexpected bill. So what happens? Their condition gets worse and worse. They end up at the emergency room, and that's obviously way more expensive. So again, I think all these things Californians know, they've experienced. And, what we're working here on the foundation is what we can actually do about it. We've got this 25% problem. It can seem overwhelming and intractable, but tell me what California is doing right now to solve it.
Look, and you're absolutely right again. Like, this is a really complicated problem and it certainly can seem overwhelming, but I also think you're right. Like, there are things that can be done. First and foremost, this state recently created something called the Office of Healthcare Affordability, or OCA. This was created in 2022. And what it does is focus on that underlying cost of care that we talked about. Remember those base ingredients in the healthcare system? What this office is doing, first and foremost, is setting an upper limit on how much those underlying costs can increase. They're now saying for the first time, those underlying costs can only increase 3% each year.
Yeah, so I think people don't appreciate what a big deal this is. For the very first time, the state is saying to the healthcare industry, you have to live within a budget so that more Californians can actually afford care.
This really is a big deal, Anne. This is like, as you're saying, for the first time, this is a limit on the increase in those underlying costs. Those underlying costs have been increasing by 5, 6, 8% every year. And so if you're going down to 3, that is a fundamental change in the status quo.
Can you tell me a little bit about why did they choose 3%?
Over the last 20 years, the average increase in family income here in California has gone up by 3%. And so the underlying message here is costs in our healthcare system can't grow faster than people's ability to pay. We need to address that affordability problem by reducing underlying cost growth.
Just to make a through line through this, if I'm an average Californian, would I be right to think, okay, by limiting that underlying cost growth, by limiting that spending in the healthcare industry, by limiting that, you're going to limit eventually the growth in my premiums? Is that
That
right?
is the basic idea here, Anne. And so it is going to take time. But if underlying healthcare expenses had been going up by 5, 6, 7%, and you reduce that to 3%, that is a lot of money that is potentially available for people that they don't need to direct into healthcare anymore. And remember, part of those dollars that are going into our healthcare system aren't making anyone any healthier. And so we need to pull those out of the system.
So OCA is obviously a big deal, but there are other efforts going on right now in the state to address this 25% problem and just the unsustainably expensive rate of growth in our healthcare costs. Can you just give us some examples of some other important things going on?
What I would say is this. If you think about OCA and this new spending growth target as maybe an overall limit or a budget for the healthcare system, what then we want to happen is the healthcare system, folks within the healthcare system, to reduce some of that unnecessary spending. And if we go back to those buckets that we talked about, that first big bucket was administrative waste. That's one area where there absolutely is a lot of opportunity to reduce spending and make healthcare better, make the experience better for people. We can simplify those billing procedures that clinics and doctors and hospital systems have to go through with patients. We can automate prior authorization processes. That reduces spending and makes the experience better. So the second thing I'm really excited about is investing in primary care and prevention. We talked about this too. There are some types of care that we simply aren't spending enough money on, or we're not directing enough resources to. If we are able to shift resources from specialty care into primary care, we're going to make it easier for Californians to get in to see a primary care doctor and address problems before they get worse, before things get more complicated, and ultimately more expensive.
All right, Christoph, this 25% problem, it's not only super important, but it's also a very complicated issue. We just scratched the surface here, but I really appreciate you taking the time to break it down at least a little bit.
Yeah, it's a lot, right? Thanks for having the discussion, Anne. I really appreciate being here with you.
And for people who want to learn more about the 25% problem and what California is doing to address it, we do have a new explainer out from the California Healthcare Foundation. We'll put the link to that explainer in the notes. And thanks for watching.